The outbreak of the COVID-19 crisis will be remembered in connection with short supplies of protective materials, not only for the wider public but also for medical workers. A lack of masks, suits and other protective equipment caused dramatic situations in many European countries. Across the continent, these emergencies have inspired citizens to step in and give help on a voluntary basis in order to offer solutions as quickly as possible. These examples show solidarity, community building and creativity in dealing with the pandemic in Europe. When medical supplies were scarce, owners of 3D printers across Europe started producing cheaper versions, which were then quickly delivered to medical professionals. The Bulgarian design studio Love to Design joined the initiative #TheGood. Here, many enthusiasts with 3D printers produced protective face shields for frontline medical workers. Within 1 month, and for free, the company printed over 200 protective face shields using materials supplied by volunteers from all over the country. Medical workers and other professionals, such as carers in nursing homes, were facing a lack of protective gowns. People with the necessary skills offered their help and often managed to produce huge quantities of such clothing. In Madrid, a group of volunteers organised themselves around the parish of St. George. In their stores and workshops, they started sewing protective suits. Many individuals, often seniors, who had a sewing machine at home, lent a hand too. They used all kinds of materials: plastic garbage bags, operating room blankets from hospitals, or special fabrics provided by local NGOs. Volunteers coordinated the production and distributed the gowns with a heart logo to hospitals, police stations, firefighters, or public administration staff. Most of the time, they did not even meet the beneficiaries, since they had to leave the protective gowns on their doorstep. Medical face masks were in short supply everywhere, despite their necessity for professionals working with COVID-19 patients in hospitals. In several European countries, spontaneously and in the spirit of solidarity, many people took the initiative and started producing homemade cloth face masks for their own use and for sharing with others, although there had been conflicting scientific evidence as to their value. Inventors developed special filters and helped to improve the usability of such face masks. Overall, most European countries have prioritized the needs of medical workers. In some countries, wearing a face mask was compulsory everywhere when leaving one's home. With the gradual easing of the lockdown, face masks are becoming the new daily reality in many countries and places in Europe. Indeed, the National Museum in Prague has already organised the first exhibition of donated face masks. We invite you to visit the Documenting COVID display at the House of European History and explore a selection of these objects in our museum.